looking towards the future, and I know nobody can predict the future, but is there anything that's going to be coming out soon with, you know, short of what I said, the knee replacement or drugs? Thank you.
I'll open that up to the panel. Anybody want to, the rheumatology group, make some, respond to Patrice in a way that might be helpful to her, thinking about potential treatment she might try?
So Patrice, some general statements first. I spend much of my time as an academic talking about pharmacological therapies for OA. I spend my entire time in the clinic as a rheumatologist teaching people to do quadriceps strengthening exercises for their knee OA, since it's by far the most effective and safe therapy we have. And most people I see still cannot do a proper straight leg raise. It's really hard to have strong quadriceps if that's the big thigh muscle, if you've got a slight bend in your knee. And many people, especially like yourself, who are getting on to later structural damage, often have a fixed bend in their knee. And you may be able to walk 5 miles, but that doesn't mean you've got strong quadriceps muscle. So I absolutely, first thing would say to you, strong quads is God. It's really what it's about, and strong muscles are important everywhere to reduce joint pain. In terms of other therapies coming, I don't think for the non-pharmacological therapies, there's a lot coming that aren't what you know of already. And as I say, strong muscles is probably the biggest core of that. For the drug things coming, you may know, and that may be the topic of other meetings from Arthritis Foundation, there are things like monoclonal antibodies to nerve growth factor that may get to market. It's interesting that drugs looking at peripheral pain mechanisms rather than anti-inflammatory mechanisms look like some may get to market. So there may be some new drugs. We haven't had new drugs in 100 years. So things actually haven't changed from when you had your first things 30, 35 years ago. Treatments are pretty much the same as we had 30, 35 years ago. Some oral NSAIDs, maybe a little bit of opioid and occasional intra-articular steroid. Things haven't changed on the drug front, but they may be about to change with some new pain mechanism-based drugs coming.
So I guess as a rheumatologist who sees a lot of patients with osteoarthritis, Patrice, I don't necessarily agree with everything Philip said. I studied to some extent biomechanical therapies for osteoarthritis, and I agree entirely with him that we're sitting here talking about drugs, but what we do in clinic is often try to improve the biomechanics of the knee. There is a promising therapy that I don't have any commercial involvement with called APOS therapy, which I would suggest you look into, which re-educates the muscles of the lower limb to walk on a different part of the knee, it looks like, and has been found in one large trial to be highly effective. And then I would also suggest, if you're miserable, that you think about nerve blocks that go to the knee, which have been now studied in a couple of different trials and are available often through anesthesia departments that ablate for a prolonged period of time the nerves that cause the pain in the knee, and are widely available through a variety of patented approaches and non-patented approaches by pain doctors and anesthesiologists, and that's also reasonable. So I think while we're having discussions about the biologic therapies, and I agree very much with Philip that anti-NGF treatments are also very promising, this is actually a potential golden age for people who want to avoid getting knee replacements. I think one part of that golden age is what we've been talking about, but anti-NGF therapies are very important. And I think biomechanical therapies are going to be part of this picture too. And there's going to be novel approaches there that include not just shoes that alter biomechanics, but built-in reminders of ways to walk and strengthen that because of wearable technologies have become available to us in ways that they weren't 10 years ago. With it remind us to walk in a certain way. When we don't walk right, we get a little buzz, things like that. I think they're all being tested, and I think many of them are very promising. So I think the answer is yes. There's a lot of promise here. But, did you have other questions? I'm not sure. It depends on where you are in the United States or elsewhere in the world and what opportunities and referrals you might get. But I think there are opportunities there. I think also the Arthritis Foundation is going to be sponsoring another one of these fora on what I would call dicier treatments, stem cell treatments, platelet-rich plasma treatments. And I think many of us in the academic community are a little bit skeptical of those treatments, but they might hold promise.